Welcome to our show, Ask Your Doctor. For today, we have Dr. Vishal Parekh, who is a dialysis and hospital consulate of Epic Kidneys. He treats individuals with all forms of kidney diseases and hypertension specialty, focuses on areas including hypertension, diabetic kidney disease, electrolyte disorders, caring for older adults with advanced kidney diseases for pre-dialysis kidney treatment, and also in hemodialysis management. He is a co-author of reviewed publications in high-impact journals, including Hypertension and Clinical Journal of American Society of Nephrology. Quality life matters is the main objective, and providing for providing for comprehensive care for individuals diagnosed with kidney diseases is their motto. So, without any further delay, let's welcome him onto our show. Hello, doctor. I hope you're doing well.
Hello, everyone. Thank you for having me. I truly appreciate the opportunity. I'm very well. Thank you.
Doctor, it's our honor because you are here onto our show. Thank you so much for tuning in. I think it's very important that we talk about a very important subject like nephrology. So without any further delay, let's get on to our show. Before that, doctor, would you be kind enough to introduce yourself and what areas do you actually specialize in?
Yeah, as you comprehensively included, we treat individuals with kidney diseases. They could include both acute as well as chronic kidney diseases. They may arise from a new diagnosis versus they may have it for quite some time.
So, doctor, now that you're a nephrologist, what kind of diseases are you dealing with on a daily basis? What are some common diseases that you're seeing, especially from the past 5 years?
Many of our patients are referred to us once initial evaluations are done by their primary care physicians, and they notice abnormal kidney function. Many a times it's known that kidney diseases are silent diseases. They usually do not present unless there are significant complications. Patients, if they develop, say, blood in urine or pain, then they are easily diagnosed sooner. However, many a times it's generally delayed until primary care team evaluates and they find abnormal kidney function. If in a patient population you were to categorize individuals with their kidney function, you would categorize them into 5 stages. And many a times patients are referred to us when the kidney function has declined to almost more than stage 3 or 4. Many a times we have seen patients who are once they're in stage 5 kidney disease.
Let's talk about hypertension. Hypertension is really common nowadays, especially here in India. I really don't know the numbers out there in different countries, but hypertension in Asians, especially South Asians, is very common. Why do you think this is happening? Is it because of our lifestyle? We have a lot of rice, we have a lot of pulses. So is anything related to our lifestyle, or is it something genetical? What is your take on this?
Yeah, you are absolutely correct. The incidence and even now the prevalence of hypertension has been gradually increasing over the last decade. And given, as you mentioned, our lifestyles today, with the advent of much more advancement in technology and a decrease in physical activity on our part, we are seeing and we will continue to see increased prevalence of high blood pressure or hypertension in many of our patients, basically.
So why do you think that is this happening? Is it because of just the lifestyle changes, or a lot of people? I'll say a small myth here. They say, "Oh, your father or my father had kidney issues, so I'm gonna have kidney issues anyway. So I'm still not gonna change anything with my lifestyle." So this is a common myth that people have. So is kidney diseases anywhere related with genes?
Compare them in two forms. One is there are modifiable factors and there are unmodifiable factors. Definitely, there would be certain individuals who may be predisposed to kidney diseases from their prior heritage. For example, many develop significant cysts and they go on to develop worsening kidney function, and they can have progression to chronic kidney disease or end-stage renal disease. However, there are several modifiable factors which include dietary salt intake, calorie intake, and decrease in physical activity. And I believe these are the most important factors where the youth today or everyone needs to keep a keen eye on and improve upon so that we are able to manage and maintain better blood pressure for everyone.
Exactly. So now that you've mentioned about salt, I think We have the saltiest food ever every single day. We add salt to basically every single thing. So, can you tell the viewers, because a lot of our viewers are South Asians, can you tell the dangers of eating too much of salt every single day?
The recommended amount of salt daily intake is about less than 2.3 grams for any individual. I think the key aspect is every individual, as they eat different, I would say, cuisines during the day, their intake varies from day to day. However, if they are noticing that their blood pressure is staying higher, they are gaining weight, they're noticing swelling in their legs, and their physicians have noticed decrease in kidney function, please note the consuming higher amount of salt is not going to be beneficial to them. It will worsen their high blood pressure and cause worsening swelling and worsen their cardiovascular disease pattern. Hence, limiting the salt intake to the best of your ability will be the most important thing they can do. They can, from the get-go, when they are cooking their meals, for example, I think each and every chef mentions salt to taste. I think it needs to be looked at and altered for everyone, that maybe less salt for better health would be a better statement whenever everyone is prepping their meals, which will limit the intake from the beginning. The second aspect
Yeah.
then becomes consumption of food that is already marked as having high amount of salt. So encouraging our viewers to keep a watch on all the products that they intake, and to notice how much salt is mentioned within those products, and to limit intake in higher quantities at a point in time. That will also help in prevention of intake of salt.
So, doctor, I've noticed, I've seen a lot of, not just my family, I've seen a lot of people dealing with kidney stones. So, can you exactly tell us what these kidney stones are? And, some people say that initially, if you have, fewer stones, I don't really know the exact terminology names, but, they say that the kidney stones are right, some are treatable just with medicines and, drinking a lot of water, but some need surgery done. So can you explain from the beginning what exactly kidney stones are and why are they formed?
Sure, absolutely. So there are several kinds of kidney stones. The most commonest ones are calcium oxalate stones. Many individuals are predisposed because of imbalances within the metabolism within the kidneys, and many of them do excrete a significant amount of calcium, say for example, in the urine. There are other substances which are also lost in the kidney, or dietary intake of which are very high, which result in increased risk for formation of kidney stones. Many of the stones, if they are smaller in size, they are easily passed. Patients are encouraged to drink plenty of fluids, especially during the summer months in our southern regions. Dehydration can result in increased risk for development of these kidney stones. High salt diet is also one of the risk factors for development of kidney stones. If the stones are significant in size and they cause blockage within the kidney and the urinary tract, they themselves can cause worsening kidney function. And hence, at that time, they can also result in urinary tract infections, and hence they are required to be removed by surgical interventions.
Yes. So, doctor, let's talk about dialysis. Unfortunately, you hear, nowadays, even in India, a lot of people are going through dialysis. And can you explain us what this dialysis is?
Sure. In individuals who have developed, say, for example, chronic kidney disease, and they progress either gradually or rapidly into end-stage renal disease, when the kidney function is about less than 15%, mostly about less than 10%, then they have decreased in their ability to remove toxins, and they have much more risk for further complications, including cardiac arrhythmias or fluid overload. In these individuals, then they need support mechanisms wherein toxins are removed, fluid is removed, and clean blood is returned back. It's done by use of, as you mentioned, devices which help in filtering the blood. and the process is called dialysis. The process involves getting treatments done about 3 days or 2 days a week at the center where it's performed. Today, with advancement, peritoneal dialysis might be the most appropriate for many of the younger patients.
So, doctor, another question that I had for you is, once a person turns 60, once, they're about 60, there are a lot of diseases that they go through, not just not just from a nephrology perspective, but from your side, what are some older generation problems that people can deal with, and what are some precautions that you can give, especially to the people who are about 60?
Well, individuals, if you think of kidney diseases amongst geriatric patients, uncontrolled high blood pressure, um, salt related disorders, low sodium levels is one of the other common complications that we have seen in individuals who have decreased intake, or they have other diseases, either lung disease or brain related disease. More than 60 years of age, we have noticed several of them have decreased oral intake, decreased intake of food. And also we notice they have increased incidence of lung-related disorders or brain-related disorders. And in these individuals, we notice that their levels of body salt or sodium levels, they tend to be on the lower side. And in these individuals, then you may be recommended that you need to increase protein intake or salt intake in your diet a bit more than you would have otherwise done, unless you have worsening heart failure, heart disease, or high blood pressure. Again, also in the elderly patients now with progressive kidney disease, newer medications are now available, which will be encouraged for them to consider in addition to their current regimen to prevent progression of kidney disease.
Yes. So I just had a doubt with dialysis again. So let's say, so now you just said that dialysis is, happens to a lot of younger generation also. So let's say a person is around, 22 or 23 or 30. If they get into dialysis, is there any way that they can continue back with their normal lifestyles, or does that depend from person to person?
So the younger patient population would be ideal candidates for peritoneal dialysis. Then they can take care of themselves better. They can do it at home rather than going to a center. And they would then also be involved in evaluation for transplantations. So that will be the key aspect. But yes, they do get back to their day-to-day lives. They are working full-time or they are full-time students.
Yes. So, doctor, can we talk a little about this acute kidney injury? So, what is this? Is it something that happens externally or something that comes from internally?
Right. So very well. For young, and so many different acute kidney injury incidences or cases are possible. Many individuals can develop acute urinary tract infection that can go to the kidney, and that can reduce the kidney function. As we discussed earlier, kidney stones can cause blockage of urine output. That gets backed up, and that can cause acute kidney injury. Many a times, patients on medications, they can become dehydrated. They can develop a decrease in blood pressure that can cause decrease in blood flow to the kidneys and result in initial injury or dissection of some tubules, which can result in decreased urine output and acute kidney injury. And hence, so there are several reasons why an acute kidney injury can present. Now, there are several other kidney diseases, glomerular diseases, that can present to us in the form of acute kidney injury.
Yes. So, doctor, are you saying that any lifestyle changes, how important are lifestyle changes to a person with kidney diseases? There are still people who don't really drink alcohol, that they have the complete, very good lifestyle, but they still go through so much of health diseases. Why do you think that has happened? Like, should we blame it on the luck or should we blame it on genes or what?
No, absolutely. Lifestyle modification becomes an important aspect in our lives today. Uh, the three aspects, as we discussed, a decrease in calorie intake, increase physical activity, and limiting the salt intake will be the key aspects that one can, in their day-to-day habits, try to change in order to prevent progression of kidney diseases. But you're right,
Yes.
not exactly that everything is genetic, and hence, there are many factors that we can work around, try to control progression of kidney disease.
Yes. So, doctor, I was going through your website and I saw something called as plasmapheresis. So, what exactly is that?
So there are certain indications, there are certain disorders wherein there is abnormal amount of a certain either immunoglobulin or protein that is causing worsening of kidney function and other organ failure as well. And during those times, we include the process called plasmapheresis, wherein in order to remove the toxin from the body using filters, the plasma is exchanged. It's removed either in the
Okay.
with albumin, or it's done with plasma from other individuals.
Okay. So, doctor, once I started going to gym, I've been hitting gym since a year. There's this one thing a lot of people started saying me. They're like, you cannot have a lot of proteins or excessive proteins because it can damage your kidneys. And a lot of young generation, just because they want to get lean or whatever their body goals are, they try taking these protein shakes. They try taking these different kinds of artificial proteins that they're taking. So, can you tell how bad it can be if one is taking excessive proteins than needed to the body?
That's correct. So there are several, as you said, proteins which are artificial, and these are not natural compounds that our body can filter very well. And hence, you may have increase in accumulation of these products over time if the consumption is beyond what the kidney capacity is to remove them. Hence, we encourage patients try not to involve these artificial proteins in their diet. Yes, you need to stick, or rather plan about 40 to 60 grams of protein during your day, as an individual is expected. And sure enough, including it in your major meals will be the key aspect to it. Individuals with significant loss of protein may need to restrict to a larger extent than other individuals who have no loss of protein.
Yes. So, doctor, unfortunately, a lot of women, they are going through hypertension. Once they get pregnant, or the pregnancy journey how is the pregnancy journey affected with people with hypertension?
That's fair. So patients, if they already have hypertension and if they become pregnant, their chances to develop worsening, say, hypertension during pregnancy are higher. Beyond 20 weeks of pregnancy, if they develop hypertension, they are at risk to develop worsening kidney function, loss of protein in the urine. They also may develop what we call seizures. They will be closely monitored, and they are maintained on medications to control their blood pressure very well. Also, they will be closely monitored postpartum, because the changes that happen during pregnancy may continue even after delivery. The key
Yeah.
aspects for them will be to continue the regimen that has been prescribed to them. Compliance becomes the most important part during the care, and to closely monitor the blood pressure at home. So, including them and other viewers, everyone needs to closely monitor their blood pressure using blood pressure measuring devices to the best of their ability at home.
And finally, doctor, can you say to the viewers about what different services Epic Kidneys can provide to the viewers watching?
Sure. We see all individuals with kidney diseases. They are either referred to us, or they approach us directly. We care for them during pre-dialysis and after dialysis, during the dialysis treatments as well. Even many of our patients have been referred for transplantation, and we continue to follow them following transplantation.
So, doctor, it was lovely talking to you. I think we covered so many different topics in just a show. Thank you again for tuning in. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.